So, so here I was, my mother feeding me Martin Luther King books, my father telling me I had to be practical. So I did go to medical school, though I also got a PhD in anthropology, and I spent time in Korea studying the healthcare system. But what I really wanted to do, and I think this dates back to when I was about 8 or 9 years old, was I thought that there were problems in the world, that there are injustices in the world, and that it was my responsibility to do something about them. So in 1987 and 1988, I worked with my colleagues to found an organization called Partners in Health. We now work in 9 countries. Tomsk is in Siberia, Rwanda, Malawi, Lesotho, you know, all those great vacation spots that you must all go to on your holidays. But we did this, and we did this with great energy. And we did this at a time when there was almost no interest. Bill Gates, had not discovered global health yet. President Bush had not announced his great initiative to treat people on HIV. We were living literally day to day, hand to mouth, volunteering our time, trying to earn money, working in the hospital while running this small organization. We had some successes. This is Caraballo, a community in Lima, Peru. We went there at the invitation of a group of Catholic priests, and we were going to do something very small. We were going to just try to help kids grow up healthier. But we found patients like this, patients who had something that we called drug-resistant tuberculosis. In other words, a form of tuberculosis that's resistant to the standard drugs. These people were so sick, they had been treated 5, 6, 7 times. They were infecting their neighbors and their family members who were dying. And we thought, we've got to do something about this. This is terrible because tuberculosis, as many of you know, is a disease that's spread through coughing. So it's spread inside people's homes. We kept saying, this is terrible. What are we going to do? Turns out the drugs to treat this disease were very, very expensive for reasons that I'll tell you later. And it turns out that our colleagues at the World Health Organization were saying, don't do anything about it. First they said, it's so complicated, it's impossible to treat. And it is complicated. It's one of the most difficult treatment regimens I've ever been involved with. Anywhere from 18 to 24 months of daily treatment, usually with an injectable. In other words, an intramuscular injection, usually in the buttocks, for an entire year. It's very difficult treatment. And yet, the only way to stop an epidemic of drug-resistant tuberculosis is to treat the people who have it. So here was the World Health Organization saying, don't do it, they usually die, it's impossible, it's too expensive, forget about it. So of course we started treating the patients, and we were very, very fortunate. Again, these extraordinary, unexpected accidents of fate that led us to one of the most saintly men I've ever known, Thomas J. White, a Boston Irish Catholic construction company owner who literally has given away every penny of his sizable fortune to help the poorest of the poor. He gave us the money to start. But the cost of the drugs was about $25,000 per person. Now, in a developing country, you don't even ever think about spending that much money for a single patient. But we knew some things. We knew that most of these drugs were generic drugs, so we didn't quite understand why they were so expensive. And we wanted to make a point. We wanted to make a point that you cannot put a dollar value on human life. That you cannot say that just because they're in a poor country, the fact that they have an epidemic disease that's spreading and killing family members is just not worth treating because they're poor. We were there once. As Koreans in the 1950s, that's just where we were. We would have been among those people who these bureaucrats would have said, I'm sorry, they're too poor. They're just not worth treating. So we figured out that, in fact, the drugs were all generic, and that if we put all our money together and try to get the Indian and Chinese drug companies to make these off-patent drugs, we might be able to lower the cost. And indeed, after about a year, we lowered the price of the medicines anywhere from 80 to 98%, making it still expensive, but altogether affordable. We did this with the almost unanimous opposition of the public health community. Now, the number of projects and treatment programs has gone up. We have now over 50,000 people on treatment throughout the world, but in 1996 when we started, there were 0 people on treatment in the world. This is a graph that shows you another disease process. These are life expectancy graphs from Africa. In other words, in some countries in Africa, we were seeing life expectancy drop 25 years in a matter of 10 or 15 years. In other words, in places like Botswana, for example, where life expectancy had reached 62, it dropped to 38 in a matter of a decade. This was HIV. HIV was decimating this population. And despite the fact that our great drug companies had found wonderful combination drugs that were keeping people in the United States alive indefinitely, the word was, emphasis must be placed on prevention. I'm sorry, the 30 million people in Africa who are infected are going to have to die. So it was the same story, once again, and people made the same excuses. It's too complicated. These people are so poor. One American government official even said, Africans can't take these medicines because they can't tell time. They only know sun and night, and they don't have watches. To which a group of Africans whom that official had visited said, he can say that if he wants, but the only one who was ever late to all the meetings was that guy. So once again, a challenge. Once again, an effort to do something, to make a mark, to make an argument that, in fact, we can treat the people. So this is Joseph Jeune. He's a friend of mine. He came to a clinic in Haiti in March of 2003. His mother came and asked us for a small donation so that she could buy his coffin. He was suffering from both HIV and tuberculosis. And as a last-ditch effort, his family had carried him 2 days on a stretcher into our clinic. We see people like this all the time in Africa and other places. You don't see people like this in the United States because we never let it get this bad. After a few months of treatment for both tuberculosis and HIV, he looked like this. We call this the Lazarus effect of HIV treatment. It convinced President Bush to commit $15 billion to treating people with HIV. In fact, President Bush's staff saw these very pictures because my colleague Paul Farmer was asked to go to the White House and answer the question, is it possible to treat people with HIV in developing countries? Joseph Jeune is now one of the most famous Haitians in the world because when I was at the World Health Organization working for another great Korean who tragically passed away, Dr. Jong-Wook Lee, we put his before and after pictures on every document that went out of the World Health Organization. The Kenyans thought he was Kenyan. They told me for sure, no, he's Kenyan. The point, though, is that throughout Africa, people thought, now this is possible. We're not going to be left for dead. We can do this. So when I was at WHO with Secretary General Lee Jong-wook, I had run his campaign, so I was really his right-hand man when we were at the World Health Organization. We started a campaign. I had been studying a lot about management theory and the work of W. Edwards Deming and how to get a movement going so that people actually do something. And everything I read said you've got to have a concrete goal with a concrete end date. So I convinced Dr. Lee to declare that we were going to treat 3 million people by the end of 2005. It was already the middle of 2003, 2.5 years, and only about 150,000 people were in treatment. Well, we didn't make it, but we made it by 2007. So 3 million people who otherwise had been declared dead got treatment. We didn't do it all. President Bush's effort was extremely important. A lot of other people were very instrumental. But by setting a really bold target for which we took endless criticism, we got things moving. So 2 years late on a target, it turns out that that's the best the United Nations has ever done on any target. And so we're very proud of the fact that people are alive now who would otherwise not be.